Before performing the whitening, ensure that the patient is in relatively good oral health and not perio-involved, exhibiting failing restorations, or is otherwise in an unhealthy oral state. Review the expectations a patient should have. Most patients will see a 6 to 8 shade improvement on the in-office whitening, but anatomy, calcifications, age, teeth condition, and hygiene all play a part in determining the results each patient will attain, so there is no way to accurately predict the results. After reviewing the patient's oral health and expectations, it's time to start the whitening. Place the retractor in the patient's mouth to retract their lips. Then use suction or gauze to dry the surface of the teeth. Make a note of the patient's starting shade before the whitening. Ensure good lighting when shading teeth for the best result. When shading teeth, if grade falls between 2 shades, be conservative. Apply vitamin E to the top and bottom lips and gums. This will act as a barrier between the gel and soft tissue. Now you're ready to apply the specially formulated whitening gel. Our proprietary whitening gel is similar to other chairside whitening products, but better because of 3 exclusive ingredients. Potassium nitrate is used to prevent sensitivity, eliminating the need for damming. It also acts as an additional oxidizing agent with the peroxide. Photo Initiator works with the hydrogen peroxide and light to expedite the breakdown of the hydroxyl radicals, producing a quicker result. Xylitol is FDA approved and highly recommended for its ability to prevent cavities. To apply the gel to the teeth, start by replacing the cap on the black syringe with the micro tip. Then apply a thin layer of whitening gel with the micro tip to each tooth individually. Avoid the soft tissue when applying the gel. If any gel gets on the tissue or lips, clean it off with a swab before proceeding. Place the goggles on the patient's face to protect their eyes from the light. Now it's time to apply the LED light for 15 minutes. Turn the light on by pressing the on-off switch in the center of the head. When the screen lights up, press Enter. Set the light to 15 minutes. Press Enter again and apply the light to the patient's mouth. The light should be placed about an inch away from the teeth. After the first 15-minute session, clean and dry the teeth with suction or gauze, then repeat the same process. Reapply the vitamin E, whitening gel, and light for 15 more minutes. After the second session, again use suction or gauze to dry the teeth, then remove the retractor. Now it's time to compare the results to the starting shade. Use the shade guide again to determine the ending results. Be sure to shade the patient in the same light you shaded them in originally to ensure consistent results. When shading teeth, if grade falls between 2 shades, be conservative. Be sure to express your excitement when the patient is done and compliment them on how white their teeth look. Give the patient a mirror to look at their bright new smile. Explain to the patient that maintenance is vital to keep their new smile bright. Tell them to avoid dark-colored food and beverages for 24 hours and to apply the whitening pen 2 to 3 times in the first 24 hours to gain additional results. Give them the maintenance products and instruct them on how to use them properly. It is vital to promote the continued use of maintenance products by the patient to drive residual sales and help maintain the patient's new white smile. Now that we have reviewed the protocol for the Bleach Bright Pro in-office whitening, it's time to review the Star Bright Pen and Home Whitening System.